Hi, my name is Pierre Scott, Staff Development Officer and Licensed Marriage and Family Therapist with RUHS Behavioral Health. I'm here to talk to you about suicide prevention and resiliency during this COVID-19 crisis. First, I would like to share with you a meme that was sent to me not too long ago that I found rather entertaining. Saw my neighbor out this morning scraping the "My Kid is Terrific" student sticker off her minivan. Guess the first week of homeschooling didn't go so well. Many of you probably can relate to the frustration of this parent during this COVID-19 crisis. I mean, it has turned our world upside down, challenged our capabilities, rearranged our routines, and it put us in timeout with our families. It has also brought us to tears at the loss of our loved ones, created economic job loss, and also put us in mourning for those that we have lost during this crisis. It can also have us feeling isolated during this social distancing time. Sometimes during a crisis, people are struggling with thoughts of suicide and they get feeling really low. And so we want to be able to pay attention to those people and be able to reach out to them. And so here's one way that we can do this. It's through Safe Talk. Safe Talk actually is a program that we have here in our Prevention and Early Intervention Department. SAFE stands for Suicide Alertness for Everyone, and the TALK stands for Tell, Ask, Listen, and Keep Safe. Tell in that people are always trying to tell us, and we want to be able to pay attention to when they're telling us that they are having thoughts of suicide or that they're wanting to die, so that we don't dismiss, or avoid what they're saying, and that we take them seriously. It also means that we ask them directly. Maybe it's an uncomfortable conversation, but we ask directly that, are you feeling suicidal? Are you talking about suicide? And then we listen to what they have to say. We listen to their story, and then we keep them safe by connecting them to resources such as Each Mind Matters or Up to Riverside. Can be very helpful to be able to keep people connected to ways that will help them keep safe during this time. Next, I would like to talk to you about 3 ways that we can be able to maintain our resiliency through this COVID-19 crisis. Number 1, balance. That is getting enough sleep, exercise, and learning to manage stress. Keeping those things in balance will help us be able to be prepared mentally and physically for the challenges that we are going to be facing ahead, and to pace ourselves through this crisis. Second is also to be able to maintain perspective and connection. We're going to get through this together. This is not the end. We're by staying connected to our friends and family and people that we hold dear, we remind ourselves that this situation is not going to overtake us, and that we can be able to walk through this crisis. And third is that when a situation presents itself, is to be able to choose to respond rather than react to the situation that we are facing. And so therefore, by maintaining balance, perspective, and connection, and be able to respond rather than react to our situation, we're able to have a healthy component of resiliency for whatever comes our way. And then it also gives us the ability to be able to see the people that are struggling next to us and be able to share with what we have learned and what we have gained through our learning and through our experience in this crisis, to be able to help lift them up and be able to make it through this. I tell you that we are going to get through this crisis together, and we will do this together. So maybe you feel like this mom in the beginning, where you feel like your world has been turned upside down and you're scraping a bumper sticker off your car, or you're just, trying to figure out this social distancing thing and not trying to feel so isolated. If that's what you're going through, resiliency has something to teach us, and we're going to make it through it. Share with us your stories about how you're handling this, and let us know what you're doing to practice this. I believe in what you all are going to try to do to be able to make us better on the end of this, as we work together and making this community a better and healthier place. I can't wait to hear about what we're going to do and what you're going to teach us. Thank you.